Welcome back to Discovering Regeneration. I have Dr. Rick here again, and today we're going to talk about stem cells.
Yay, stem cells.
Woo-hoo.
So stem cells are quite interesting, and I've read about them because you started doing them. But I'm not sure I really... So I know about stem cells with like how you can help yourself with fasting and certain foods. But I don't know if I really quite understood what's the difference. Like if somebody comes to you to get stem cells, how does that differ from like if I'm going to fast and like to encourage my stem cells? How's it different? Because everything I read didn't really go into that much detail about it. So I figured I would.
All right, well, first of all, when you're born, 1 out of every 10,000 cells in your body is a stem cell. Then I believe it's when you're a teenager, it's like 1 out of 100,000. Then when you're around 30, it's like 1 every 250,000 in your body. You get to around our age.
So 35.
Yeah, 35. No, yeah. More around 50. Then it's about 1 in every 450,000 cells in your body is a stem cell. Then when you get to the point when you're pretty much like in your 80s, they're pretty much gone. It's like 1 in every million.
Oh, wow.
So stem cells, if people don't know, are, your body's repair system for your body. So a stem cell can turn into anything. So you cut yourself, you bang yourself, how do things get fixed? Stem cells involved in that process. It's involved with your immune system. So, helping kill viruses and bacterium and all these different things in our body. So your question, I guess, was, I'm already getting off track, but your question was, stimulating your own versus why would you need? In many cases, God gave you what God gave you. So your body is able to repair. But as you get older, as I was explaining, there's less and less left in your body. So what happens is the stem cells that are left go to areas of your body that have to work. Like if you have a bum knee, you still can function. Mm-hmm. I mean, you might be walking and hobbling a little bit, but you're still functioning, meaning your brain is still firing, your heart is still working, your lungs, your liver, your internal organs are still functioning, but your body's kind of taking a precedence where your stem cells are going to go. Okay. So where I kind of see it, like one big place, like you'll see like people in their 30s to 50s. A lot of us are starting to have things wear out. Like you might have a rotator cuff issue or a knee problem or hip problem. It's starting to have some of these orthopedic problems. And sometimes your body can fix them, but sometimes it can't. So, and yes, you can be eating certain things. You can be doing things to stimulate your stem cells, but that's often not enough to just bring that many to an area to heal. So that's where I think stem cell therapy just is incredible. So you can get them in, the way we do in our office is we inject them, not necessarily site-specific to a knee or to a shoulder. We want them to go systemically in the body. And they go where there's the biggest fire, where there's the most inflammation to heal it first.
So when you're getting an injection, you're adding, obviously, but I mean, how many are we talking about? We're talking about a few hundred, or like how many stem cells get injected?
I've seen millions. Like the company I'm working with right now is 20 million. There's different amounts. I mean, I've seen 20 million to up to 100 million.
Wow.
So I might be changing some things shortly, but it really depends. I think there's so many factors. The viability. Like when I was looking into this, I was looking at a company where they have viability studies because it's important to see. Right. You could say you have 20 million or 10 million or 50 million, but if they're not making it through, that number's going to certainly be a lot lower.
So after the injection, how long does the stem cell stay viable? How long is it active for?
It's amazing. About every 28 hours they replicate for up to 6 months duration. So if you're getting injected intravenously into the bloodstream, they're going to keep replicating. So if you start with 20 million, that 20 million is going to keep improving. So you can't beat that versus what your body can produce. Now, granted, if you're like a little kid and you've got some major trauma or something that's happened, I really feel that, kids have a better chance of recovering. But if you're 40s, 50s, 60s, 70s, 80s, and you have something really significant happen, a lot of times your body's not going to be able to handle that overload.
So if you, just theoretically, but like if you're, I don't know, in your 60s and you get an injection, does that mean like compared to you as 60 and not getting an injection, you fast forward to 80-year-old post-injection would have more stem cells in their body. So that should last going forward, right?
It's going to last, but it really depends on the person and what's going on with them as well.
Okay.
Like, how screwed up are they? For example, if somebody comes in, like I've had this happen where, but just like chiropractic, nutrition, lots of different professions, lots of things that we do, you can't guarantee things. Meaning, somebody comes in, yes, I help people with lower back problems. Yes, we can improve digestion. If somebody comes and says, I want this stem cell therapy specifically for my knee, well, the way we're doing it, injecting them systemically, if you're somebody that's of advanced age and you have a lot of things going on, and there may be things you have going on that you don't know about. What if you have cancer brewing? Mm-hmm. What if you have a lot of plaquing in your arteries? What if you've got some degenerative process starting in your brain? Like, there could be a lot of other dysfunction going on in your body. Your body's going to take precedence where it puts it first. Mm-hmm. But in a sense, for me, praise God. Because if I have something else going on that's really kind of scary, I'd rather the stem cells kind of go to correct that first.
Right.
So they're going to go to the area which is the most inflamed, the most upset first, in the party that your body looks at it before it goes out to an extremity. But in many cases, one injection can do that. Like, I had my first stem cell therapy June of 23. With my MRIs and everything, I had shown that I had a torn labrum, 3 rotator cuff tears in this lovely shoulder, an 80% tear in one of my muscles here, and 2 herniated discs. Sadly, I can attribute a lot of that probably to my profession of 20-something years of doing this with people and being a butterfly swimmer and playing a lot of racket sports. Mm-hmm. But for me, and I think because I've worked on other things already, I'm not that inflamed. I eat pretty clean. I live a pretty healthy lifestyle. I didn't have a lot of other things going on. So I'm trying to think. It was about 6 weeks in that I started to notice, I'm like, whoa, I have more range of motion in the shoulder. Because my shoulder I had a little bit of an adhesive capsulitis or frozen shoulder from all the compensation with this. And I was like, wow, I can get my bra on now. Like, there's things I can do. And then within probably 90 days, both of my shoulders were healed and my lower back's never been a problem again.
But just from a stem cell point of view, it almost sounds like you were kind of turning back the clock.
You are.
From that point of view. So like, 80-year-old you would actually have more stem cells in you compared to this 80-year-old you if you didn't have the injection. You know what I mean? You
are turning back the clock. I said...
That's amazing, though.
I've had 3. I'm kind of a little bit addicted to this at this point. But the first one was really to fix my orthopedic issues. The second one, I didn't even know I was going to get, but somebody wasn't able to come in. And what were we going to do with those cells? So I took them. And for me, the second one gave me more energy. I had more mental clarity. And that's where I felt that I've gone backwards, meaning I'm almost 53 right now. And when I had it last summer, I really felt that I felt back like I was in my 30s again. So I've had more energy, the more get up and go. So I really do feel like it's reversed the clock for sure. And when I speak to some other friends of mine that are doing this in their office, one of my friends' offices, she's really considering it more of an anti-aging process, which it is. You're reversing degeneration.
Almost preventative. Like, even if you didn't have anything pronounced, this sounds like something you would want to do anyway, especially after you start getting up, over 40 possibly, but definitely over 50, because you're basically restocking the shelves, or filling the bank account going forward. So you have the ability to heal more than you would have.
To me, that makes complete sense. And I think you and I, like where we are with our practices and our minds and our whole philosophy on life, to me, I find it like an essential way to add in, in addition to your healthy eating and your vitamins and your water and your exercise and attempting to reduce stress. For me, this is another thing to add to the thing to, yes, improve your quality of life, quality of your years, and to reverse things as well.
Plus, now that we're older and hopefully a little smarter, taking care of our bodies a little bit better, it'd be kind of nice to, get some of those stem cells back in circulation and maybe take care of your body a little bit better, so you can use them, better. I like the idea of it being like an anti-aging. I think it's kind of cool.
True. So I love that idea. I feel like a lot of people, there's some people that'll get that. I think eventually they'll get it more. I think a lot of people, the number one reason I asked the lab and the company that I'm utilizing the cells from, the number one reason people are seeking out stem cell therapy is for significant arthritis in the knee. Number one. I've seen that a little different in my practice, and maybe because the message I'm giving is a little different. I've had people with autoimmune disease. Youngest we've done is 13. My brother's whole story, which led me into this, was traumatic brain injury.
Right.
So I've had a number of people already with TBIs, the abbreviation for traumatic brain injury, and other degenerative processes.
Would be really interesting if they would do a study with using stem cells as a preventative, and find out how many people in that group still ended up with arthritic pain in the knee and all that. Like, that sounds like it'd be a worthwhile way of maybe heading those problems off before they become problems. Especially as we get 50, 60, 70 years old, knee problems are a thing. It's part of life. But imagine if you got stem cell anyway, like before you were falling apart, you got stem cell injections to try and help with repair, controlling inflammation, controlling repair. That's why I think the magic really is. Like, I think that can be amazing,
I mean, I get it. I mean, my goal is to do this at least once. I mean, like once a year. I'll be superhuman.
Yeah.
No, but I think that makes a lot of sense.
Well, especially if you can fly sometime. Just superhuman. So more recently, I've got some shoulder stuff going on. I usually don't have pain. Now I have shoulder pain. So I'm obviously not going to get steroid injections. Aside from all the bad side effects, they really don't last that long. So if I got stem cell injections instead, how long does that last?
Well, the thing is, the stem cells go to your shoulder and repair. I don't know what's going on with the shoulder right now, if it's a tendonitis issue, if there's arthritic change, but it can really reverse all of that. So it will decrease. The number one thing I see immediately, especially people that are extremely inflamed, is it'll de-inflame them quickly, which is amazing. Obviously, rebuilding tissue takes some time.
Right.
So a lot of the slides and the things I've seen have been 90 days out. My own story, things kind of started to heal probably around 6 weeks out.
It wears off in 90 days or?
No, that's where I was starting to notice the improvement and the
gotcha.
changes. But once something's fixed or, reversed aging or reversed degeneration, it's done. I mean, you
cool.
reverse it. But not to say you can't screw it up over a number of years. But if it's taken you into your 50s to get to this problem, minus, if you had some sort of horrible trauma, it's not going to you stop the stem cell 6 months later, you're going to reverse and go back to where your shoulder was before. That's not. If it's repaired it, it's repaired it.
Okay.
So
that's one of the big differences, I guess, with like going with the anti-inflammatory drug versus repair. So it's with repairing, and it doesn't just wear out and have to do it again, right?
Right, and an anti-inflammatory drug is just reducing the inflammation for the time being, and it's not repairing anything. It's just treating a symptom.
Very cool.
And I think the thing is, too, what I would really like to see is if people are making this investment to improve their health, it's like, what are they going to do on the back? Once they've had these therapies or this therapy, what are they doing to make changes? You don't want to get back into those same patterns doing the same thing. So it's the stuff you and I have talked about and strongly believe in. It's, what are you doing with your diet?
Right.
Are you moving at all? What's your stress like? Are you doing any weight training? If you are investing in your body to this level, you really need to keep investing in your body.
Gotcha. Well, that's the whole, youth is wasted on the young. Because like now that we're older, we see the mistakes we did make, we can't go back. But now it seems like we can go back. If you get the stem cells put in, you actually have the ability to repair and start, not quite, from 20 years old on, but kind of.
Exactly. And
then you can get into your 70s and 80s with a lot better health. So I love that. I think that's fantastic.
And I think I think your health is the most important investment. You can live long, but if you're not living a good quality of life, what are you living for?
Well, we always say that, but it's like, I don't think you really appreciate, not you, but I don't think people really appreciate that until they lose their health. And then they have a deeper appreciation for, if you don't have health, you don't have anything. Because you'd give all the money you have in the world to get your health back, but you're willing to sacrifice your health to get money. It's a cycle,
And I do agree with you too. I think I'll even say, even myself, I've taken my health for granted in the past. It's like until something happens, you're like, oh boy, You don't, especially when you're younger, you don't think about it.
Right. Well, I think that's just how people are wired. I mean, if everything's operating the way it's supposed to be, you don't notice it. And it's difficult to notice things that just are not complaining. It's working. So it's not to be ungrateful, but it's like, you don't normally wake up in the morning and like, thank God I can stand again. Like, well, you can always stand, so until it goes away, you don't really have an appreciation. That's why I love the idea of doing the stem cells as preventative. I think that's huge. So
I
awesome.
agree. So the stem cells we're using are human umbilical stem cells. So let me explain that a little bit because that's important. For me, looking into this whole thing, because originally, as you know, I was looking to help my brother with a traumatic brain injury.
Yeah.
His accident was 2019 and is pretty rough shape once he got out of the hospital and everything. So I started looking into different types, and there's a couple that were, in my opinion, a bit unethical. For example, and I wasn't really thrilled with embryonic stem cells. There's risks with amniotic coming from the amniotic fluid around the sac. There's placental, and those still the little concern. And there's issues with cellular debris, and that it's not really just pure. There's a lot of extra stuff. And then I stopped my search. The fourth that I found was autologous, which I was like, all right, that's the one that seemed to make the most sense. So autologous basically means is they're grabbing it from you. Most of the time they're grabbing it out of the marrow and your, top of your femur here, your hip. And I said, gosh, my brother's been through so much. Do I really want to harvest cells through that bone? And that's supposed to be a very invasive and painful surgery. And truly, he's been through hell and back. What is he even going to have left?
Yep.
So I stopped my search. And then it was honestly a blessing. A patient came in and told me about her husband and where he went to have this done. And that's where I found about human umbilical stem cells. So what I like about this is everybody's safe. There's nothing unethical in my opinion. So basically they're following moms throughout their pregnancy. And they have them on a whole prenatal care kit, which I like because you want to know that they're healthy throughout. And basically what happens is the baby's born. Everybody's, the baby's safe. The mom's healthy. The mom's stable. And then they clamp the cord. So they're not cutting the cord because that actually signals cell death to these cells. Mm-hmm. So I thought that was pretty cool. They clamp the cord in a closed unit. They're extracting the cells and they're sending them back to the lab and they put them through advanced serological testing. So more testing than you'd even get into blood bank, which I really like because if these are going to be injected to anybody that I care about or anybody in general, I want to make sure that they're safe. So they bring them back to the lab. They spin them. They separate the cells from the blood and the plasma because that's important because if, say, you're a blood type A and I'm a blood type B, we don't have to worry if it's just these mesenchymal stem cells about any sort of tissue rejection. So those are the ones we're using, and that's how they're processed.
Cool. Well, it sounds like you really did research on it. But a lot of other companies are I think that's one of the things that when we talked about stem cells initially, that you were having a tough time finding companies that you were happy with.
Well, I mean, for me, ethical is very important, ethical, moral reasons. And just me being me, I wanted something that was here in the United States. Yeah. I mean, there's companies all over the world that are doing, and I'm sure there's some wonderful places. There's wonderful companies out there. Actually, I didn't even say that. I have no idea if there are wonderful companies out there. There's companies around the world that are doing this, but I per se haven't looked into the regulations to see what's going on or how they're doing them. Yep. So I think the first thing is you want to find a company that's transparent about where they're sourcing these things from and how they're testing these things. Yep. And if you can find viability studies to see what's going on. But I know people are flying out of the country and honestly, they're spending thousands of dollars. And the ones that I have looked into, I haven't been too thrilled for a number of reasons.
So, okay.
Sure.
When we were talking about fasting and I know that fasting, can help stimulate your own stem cells and all that. And I know getting the injections is quite a bit different because it's like turbocharging everything.
Right.
So after somebody gets an injection, are there things that help and or hinder the progress of that therapy?
True. And there's even things we even have pre and post therapy guidelines. So I can go into that. First of all, there's certain medications that, obviously if you're in the middle of a course of antibiotics, that's killing a bunch of things.
Yeah.
Not the time to do stem cell therapy. So you really want to wait for a couple weeks till people are done with that. That will definitely screw up the effectiveness of stem cell therapy. Statin drugs are another thing. So with a recommendation with the doctor, which I have a medical doctor as well that works, over me, but we will consult with people's physicians. But statin drugs will kind of reduce the effectiveness.
Okay.
So you want people off them prior to and for a few weeks afterwards. And shoot, I can get in statin drugs, but I'm not even going to go there right now.
Yeah, it's a whole other subject.
There's a couple other things. Cancer is a contraindication if people are in chemotherapy, not a good idea. But anyway, afterwards, prior to, but more so afterwards, we want people to be eating clean. We want people to be hydrated. Very important for blood volume and everything else. We want people to be off of alcohol for a bit of time. For a number of days, we want people to not be working out as aggressively.
Okay.
Because if you're really killing it and lifting really hard, you're going to probably cause some stress and inflammation in all these other joints. And really, we want the stem cells to go where they need to go. And we also want to take that extra stress off the body.
Okay.
So I really think there's more that can be added than just, hey, here's this little sheet of paper. Don't do these things for 3 days and we'll see you later. I really think doing some lifestyle things would make a huge difference in regards to just giving your stem cells the best shot.
So it sounds like we're born with stem cells and we do regenerate some of them, but it sounds kind of like we can, according to lifestyle, we can burn through them faster or slower than maybe somebody else. So is that accurate? And if so, does that mean somebody who has more inflammation throughout their life, more injuries, probably has less available stem cells than a person of the same age that didn't have all the inflammation and injuries?
I would say you're dead on. Your body has a bank of stem cells. You only have so many. And that's why, when you're a baby, 1 in every 10,000. And then it goes to when you're older, it's like 1 in every million or even less than that. So yes, lifestyle plays a huge role. What you're eating, what you're smoking, what you're not smoking, what you're drinking, what you're exposed to. And then all the traumas that play into, have you been really hard on your body?
Right.
Have you had, have you played some really crazy sports? Have you had horrible injuries? So yes, there's a bank of stem cells and they're going to deplete. So the more chronic illness you have, or the more inflamed you are, or the more things you're dealing with, there's going to be less than somebody that's actually been blessed and hasn't been in trauma, has been easier on their body. So, and you can see that. I mean, look at smokers.
Yeah.
I mean, just look at how or people that drink heavily.
Well, even athletes also.
True.
They get to older age and they can barely move. I can think of a couple professional athletes who definitely had inflammation issues, and now they're not old, but they don't move well.
But just a repetitive trauma.
Yeah.
So, and that's how, if you look at how people fall apart, it's a similar thing. Your body has precedence where the stem cells are going to go. It's, from the outside in. So at first, everything's okay when you're younger.
Right.
Minus, you get hit by a Mack truck or something that's absolutely huge. So as we fall apart, it's the same thing. You'll see the extremities going first because our body's taking precedent with the stem cells to kind of run the internal organs that are necessary for life. So
Makes
I think
sense.
I mentioned it before. Your brain, your heart, your lungs, your liver, your kidneys, all those things that we absolutely need. But you have an ankle that's had some damage, you can still function, but you can't function without a heart and a brain and lungs and some of these organs.
I don't know. I've seen quite a few people function without a brain.
Well, that's a whole other story. But you know what I mean? All jokes aside.
Yeah.
So, I mean, that's how we fall apart, and that's how we're going to regenerate as well. So if you get stem cells, specifically, if you have a physician that's injecting them right into the knee, they're going to go to the knee. But you're also losing some, too, because they're not all getting to the bloodstream. They're fixing that one process. That's why I love the idea of getting them an IV where they're going systemically.
Yep.
So if we're talking from a systemic application of stem cell therapy, it's going to go to the area that's most inflamed or most of a concern first. So it's going to hit your vital organs. I think even with my brother, it was a miracle. Less than 48 hours after he had them, he started talking a mile a minute. He had more effect with his expressions. So I know that crossed what we call the blood-brain barrier and it went right up to his brain. Mm-hmm. I mean, that blew my mind. So yes, it's going to go to your organs first before it hits extremities. I was blessed. My first application, it went to my extremities. So that tells me that I don't have as much going on as some people. At least I hope not.
That's good.
Yeah.
It's a weird flex. My organs are in better shape than yours. It's a chiropractic flex.
It's a nerdy thing to say. It's a real nerdy thing to say.
But that's one of the things I think is, I know I'm harping on this, but we're all about the terrain, right? So, and longevity medicine is about managing that terrain, just like health is about managing the terrain. The thing I love is I think it's amazing you can repair knees and ankles and joints and such. That's amazing. But I really think, for me,
right,
the magic is the fact that you can set the clock back for your body's ability to heal as if you were in your 30s and you could be in your 60s. Even if you didn't have knee pain already, doing this now before you have knee pain sets that healing clock back to being in your 30s. That's magical. Like, to me, that's where the real magic is.
I agree.
Because now we're older, hopefully taking care of ourselves a little bit better, a little more aware of where we are going to end up if we don't take this seriously. And now we get a second chance at that. That's, to me, that's really powerful.
To me, I find it quite miraculous. And so, no, I guess I've been talking a lot about orthopedic issues, but yes, the whole anti-aging capabilities and even all these underlying things that we don't know about.
Yeah.
Like I was explaining the visceral organs and stuff like that, but it's immunomodulatory too, meaning it can kill it's been shown to kill hidden viruses and bacteria and fungi and all these different potentially parasites. So there's all these underlying things that could be causing problems, which I really do feel are a huge causative factor with disease as well. Mm-hmm. So you're reversing so many different things. It's not just about joints and bones.
Well, disease, I think Dr. Sean was talking about, he doesn't subscribe to the germ theory. Mm-hmm. And I don't either. So it's not that I don't think they're a thing, although that point can be argued too, but it's that I think that they're opportunistic. And when you don't have the healing capability that you used to have when you were young and healthy, some pathogens, both exogenous and endogenous, can take over. There's a theory in Chinese medicine that sometimes you've got some pathogens that were too strong to get rid of. And so your body kind of does a whole North Korea, South Korea thing where it's just kind of a truce, right? And what happens is it keeps a stress on your system. But as we get older and we're not able to keep our end of the truce, when we start weakening, the pathogen comes up again.
Exactly. I mean, we think about, like, say, people have been exposed to, have had chicken pox in the past.
Mm-hmm.
And, and they end up with shingles. Or, you've got, lots of different...
Yeah, it's a virus that lives within you.
Exactly.
And now you can't keep it in check anymore as we get older. So I think this is where stem cells could really be like absolute life-changing. I'm harping on, I know. But
no, I completely agree. I know one thing I was fascinated about when I was in chiropractic school, we took a microbiome class, which actually I could have gone into that. I like microbiology is fun. But I remember we did throat swabs on each other. Luckily, I wasn't one of them, so another woohoo. But about 50% of my class had strep as part of their normal flora. But they weren't sick with the strep infection. However, when they get run down, obviously that's going to become an opportunistic thing to kind of take over.
Yeah.
So
we have E. coli in our intestines, right? Like naturally occurring, kept in check. And so it's all about balance.
Right.
And as we age, the process of aging is naturally unbalancing. So finding out, now that we understand a little bit more about the body, helping the body to rebalance some of those areas so it can provide for itself. Anytime you can get the body to provide for itself is a better way to go than getting medication to take over for the body, which always has horrendous side effects along with it.
Well, and I think you and I have that mindset shift. Like I grew up actually in a very medical family, although my mom may have taught health and some things. Still, I think for me, that's one blessing with chiropractic school and looking at things differently. But you and I definitely see, like, what can we do to maintain not even maintain, what can we do to optimize or improve our health? So I think that'd be wonderful if people really saw this, like
Yeah.
this big aha moment. And I feel like where I'm located here in Florida, and there's a lot of, it's a very active lifestyle. I see even people come into my practice like that. And I remember up in New York, where I'm from, I remember the teachers one day in class kind of joking about, wouldn't that be great if a patient came in and said, hey, I'm here for prevention. I get that regularly.
Really?
I really do. I think in this area where we live. So I really do hope that this is something that people would include in their holistic and healthy and preventative lifestyle.
I think that will probably happen as they are on the cusp of, problems.
Right.
The way it is now, if they don't know that there's a possibility of doing anything, they wait until something's broken and then they go get a shot or whatever. But when they have a better understanding that there is something to do about it, earlier is better than waiting until it's broken. I think people will get more proactive. But this is still pretty cutting edge stuff.
No, it is. And I'm trying to think the name of the man that wrote this. I've had a patient recently tell me, and I need to look this up. But he said people that are doing this now are early adapters.
Yeah.
Which I would consider, like, for health stuff, yes, I'm an early adapter because that's what makes me tick. Now, when it comes to technology, I'm not an early adapter.
Yep, I noticed that.
Yeah, I'm sure you do. Look around here. Look around.
But certain things. So so I'm off topic slightly, but we were talking about crypto earlier, and people doing crypto now are early adopters, but it absolutely is part of the future. Absolutely. We just don't know how it's going to be part of the future. This is absolutely going to be part of the future. We may not know how. I would love to see it become a thing that people just automatically do once a year or once every other year after a certain age, to try and head off any problems that might be down the road. I think it would be amazing if it this became part of what you did. After 50, well, every 5 years we get an injection just to kind of make sure that you have the ability to heal correctly. That'd be amazing.
It would be. And I mean, I don't know if I want to go there, but I just feel like there's a lot of hindrances to that, like pharmaceutical companies and different, I know in other countries, some of this is even covered. Now, one thing I'm aware of is wound care. It is now.
Yeah.
And there's actually a doctor I'd like to interview locally that is a podiatrist that's doing wound care with stem cells. And so he's healing, non-healing ulcers and all kinds of things. Now, that is a covered service through Medicare. The type that we're talking about is not.
Yeah.
But that would be a beautiful thing if number one, I think with time, like you said, more people will see it, more people hear about it, more people start to do it.
Well, that's another one of those things where it's like absolutely going to be part of the future. We don't know how yet, how it will get adopted. We can't quite see. We see some possibilities, but as it gets used in different areas, I think it'll become mainstream. Maybe not all aspects of it. I think my favorite story about that is Viagra. It was never intended for how it's used. It's like that was a side effect, and they were like, "Oh, wait a minute," and they put a different name on it and sold it differently. So I think same thing here. Not quite the same thing, but going forward, you find different uses like diabetic sores, where it works really well, and burns. I understand stem cell works very well for
Exactly.
burns. But as it gets more mainstream, I really hope it gets into preventative. That could be completely different. Have you seen? It's scary. To me, it's scary. But have you seen pictures of the Golden Girls and the people from Cheers? How old they were?
Yes, they were yes.
They're 30s and 40s.
I know.
And we're more than that. And you're like, huh, interesting. And the Golden Girls, I'm older than all the Golden Girls except for the oldest.
Another one is even Archie Bunker. That was another one too. I couldn't believe how young they were. I know.
And you're like, hopefully I don't look like Archie. But
you don't look like Archie.
Thank you. But
hopefully I don't look like Blanche.
No, you definitely don't. But we don't age the same as we used to, and I think some of that is nutrition, and being aware of some of these things. But imagine what it'll be for our kids if stem cells become part of a normal aging process. Getting injections. You might have 50-year-olds that look like today's 30-year-olds. That can be amazing.
And what I love too, it's not all this plastic surgery and all this baloney and sticking Botox in people. I mean, that's something that does not resonate with me at all.
Well, me either. That's horrendous. But injecting a little bit of realism, though, I don't think we will get to the point where you can be 80 with 50 years of sun-damaged skin, expect an injection and turn it into 20s.
No, I think we have to be realistic about things as well.
But I think you could be in your 50s getting injections and slow the damage or even repair some of the damage. So when you get to 80s, but the problem is you can't compare yourself to yourself, right? You can't compare pre and post 80-year-old you. So that's where education comes in. When people start to understand that this is helping to increase, your healing ability, slow down aging, blah, blah, blah. I think it'll become more and more mainstream. So I am up, a couple hours from you, and I know I need to get it. There's nobody up around me, but I know I can come down and see you, and you'll take care of me. But how accessible is this for people in Florida or even outside of Florida, to get this done?
Well, I'd say very accessible. It really, a lot of this we can do before you even show up, meaning like I have to get a history. Okay. So there's extensive paperwork you have to fill out because we want to know what you're doing, what your lifestyle is like, what vitamins, minerals, if there's any medications that we need to kind of discuss or things that are going on first. So that takes some time, but really come and see me. You can drive down, you're here today. But people can, drive to me. The procedure itself, you're in my office for less than an hour.
Oh, wow.
So truly somebody can come from Buffalo where I'm from. They can come down, they can have a little vacation.
Yeah. Or
they can really just come for the day or come overnight and fly right back home. So I would say it's extremely accessible. This is not a multi-day process.
So maybe this is a little off topic, but do you work with many people that that they're going to be here on vacation, limited time? So you schedule that so they are in and out pretty easy. So they can enjoy their time in Florida but still get their therapy.
No, I have. I've actually, and more recently I had somebody drive up from Miami. There are patients of mine that used to live here, moved to Miami. They came up that day they came up the night before, had dinner with some friends, had the stem cell treatment, and were driving home. I had another girl that came down from North Carolina. She stayed with her parents up the road a little bit, like Wesley Chapel, and then came down for the therapy.
So you're not laid up or anything after you get the...
Not at all.
Okay.
Not at all. I mean, the only thing I would say is you just want for a few days just to kind of chill. I don't want anybody to do anything extremely stressful or like work really hard. I don't want them lifting heavy weights.
But the patient itself, they're not worn out. You just don't want them to overstrain themselves.
Exactly.
Okay. So when I get mine done...
Correct.
Just in the interest of saving time, we can do the paperwork before I get here?
The paperwork has to be done before.
Okay.
Because especially I want to see what you're taking and if there's any medications or any sort of, or if there are any relative contraindications.
Okay.
Because I'm not going to have you, there's a couple of things that need to be done a couple of weeks ahead of time, even like anti-inflammatories, or if you're even on turmeric or something like that. I kind of want there to be an inflammatory response in your body. I don't really want to dampen that. So I really actually like to have that paperwork filled out a couple of weeks prior to, or I'd push you to a different date. So paperwork filled out, understand the pre-therapy guidelines, what we're doing post-therapy, and then it's just a matter of scheduling.
So we do the paperwork, do a phone consult, we give me all the guidelines and
exactly.
Blah, 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 and then we pick a date. So come down, get my injection, IV rate.
Exactly.
So, and then I can go to the beach?
You can certainly go to the beach and relax that day
with
drinking a big glass of water because hydration is important.
I've heard that.
Exactly.
That's a rumor.
So Dr. Rick, I really appreciate you coming back yet again. And we'll keep doing this because I really enjoy talking with you. So anybody that's listening that's interested in stem cell therapy, my name is Dr. Kristin Kulju. My business is Discover Regeneration. It's easy to find me. It's discoverregeneration.com. I look forward to helping you.